Okay, so today we're going to talk about suicide prevention. This is a heavy topic. It's probably like an emotionally charged topic as well, but it does affect a lot of people, and it's important to understand what you can do and how to help those around you. So today we're going to do some myths and facts about suicide and warning signs as well. We'll also go over how to respond to those around you that you may be think are experiencing these thoughts. And then go over a little bit more in a little bit about suicide. According to the CDC, there's a suicide death every 12 minutes. There were over 47,000 suicide deaths in the United States in 2017. According to Utah's public health data, Utah has the 5th highest suicide rate in the country. In 2019, suicide was the leading cause of death for Utahns aged 10 to 17 and the second leading cause of death of ages 25 to 44. Alright, so let's get started with some myths and facts about suicide. These could be like statistics or some sayings that may have been thrown around before that you may have heard. So, number 1, talking about suicide and suicidal thoughts encourages suicide attempts. So I'll give you a second to think about that. If you said this was false, you're right. So talking about suicide gives an opportunity for these people to express their emotions, their fears, and their worries. Talking with them will help them know that they're not alone and will allow a safe place for them to talk about their feelings. All right, next. Adolescents of the LGBTQ community are 5 times more likely to attempt suicide. Give you a second. This is actually true. This population is especially vulnerable. They may experience bullying or feeling like they don't belong. It's definitely important to check on these friends. Next is a fairly common one heard. When someone has decided to commit suicide, they cannot be stopped. This is definitely false. These people can be helped. There are warning signs to watch for, which we'll go over in this PowerPoint. And these can be signals out there to help possibly prevent suicide. These people are not beyond help and need the opportunity to receive it. And then one last one. Suicide is the 10th leading cause of death in the United States. And this one is true. In a study done, there were 1.1 million suicide attempts and 44,000 suicide deaths in the year 2015. So definitely a lot of lives are affected, a lot of families as well. Okay, so now that we debunked some myths and learned some facts, let's go over some risk factors for suicide. So here are a couple common risk factors. Previous suicide attempts. This is probably the number 1 risk factor. The first 3 months after a suicide attempt are critical and have the highest risk for a repeat attempt. Mental disorders could also be a contributing factor. This is not just talking about depression. This could also be other mental disorders as well, such as schizophrenia or bipolar disorder. A lack of social support and sense of isolation can contribute to feelings of hopelessness. It's important to be a friend and check in with those around you. Easy access to lethal means. The more lethal a method of suicide, the higher chance of success with that attempt. Alcohol or substance abuse may be a contributing factor as well. And these people may or may not have history of being abused or being in an abusive relationship or trauma, including physical or sexual trauma. And then they may also have had a recent trigger in their life that causes them to feel the need to turn to suicide. So this may be the death of a loved one, a breakup, losing their job, or being diagnosed with a serious illness. People who attempt suicide or have suicidal thoughts may have none, one, or all of these risk factors. So for those who show risk factors, or not, let's go over some warning signs of suicide. So these include talking or making plans of suicide. They could possibly be making final decisions for their lives, such as like finalizing a will. They may feel hopeless about the future or withdrawal. They may not participate in social activities that they used to or they used to enjoy previously. They may have mood swings or be upset or angry or cry, and they could have outbursts as well. You might see them sleeping a whole lot or not at all. Some more warning signs include giving away prized possessions, previous suicide attempts like we talked about before, depression. They may also eat a lot or very little or not at all. They may express feeling like a burden or that they are worthless. These are all warning signs to watch out for. If you have a friend who is displaying these warning signs, there are things you can do. So you might be asking, what do I do? What can I do? Well, here are some ways to respond to those that express that they have suicidal thoughts or that you suspect might have suicidal ideation. First things first, always take all threats of suicide seriously. Suicide is not a joke and can be a serious and fatal consequence of some actions. If you believe that they're at risk in the moment, do not leave these people alone. Talk to them. Ask them if they're having suicidal thoughts directly. Guide them to professional help and ask them to seek counseling or call the National Helpline. Provide an environment that they feel comfortable talking about their feelings. And this next point is important, especially for youth. Do not ever keep secrets regarding your friends or someone you know's suicidal ideation. Suicidal ideation is important to report and to receive help for. Some more responses you can do is ask some questions, even if it may be awkward. If the situation calls for it, you may need to ask them directly if they're having suicidal thoughts, if they have a plan, etc. Talk to an adult about the situation. This goes for adolescents as well as adults. Finding a trusted person who you know can handle the situation if you cannot. Being non-judgmental. Allow these people to express their feelings. It's probably an emotionally charged time for them and they need an outlet to respond and express these really heavy emotions. Encourage the person not to turn to drugs or alcohol. If appropriate, remove potentially harmful items from the situation, such as a large amount of pills or firearms. And lastly, let them know that they're not alone and that you're there for them. Remember to reach out for help if you feel this way. There are warning signs for suicide. It typically does not happen out of the blue. Lots of media glamorizes suicide, but suicide is a serious and sad reality for a lot of people. If you or someone you know is in need of help, call the National Helpline for Counseling at 1-800-273-8255. If you or another are hurt or you think someone might hurt you or themselves, call 911 right away. And that concludes my presentation for today. Do we have any questions? No? Okay, and here are my sources.